everyone, and thank you for joining us for our Systems for Action Research in Progress webinar series this morning, or afternoon, depending on where you are. My name is Amelia Mitchell. I am an intramural researcher with S4A, and I will be presenting our research team today. So as many of you know, Systems for Action is a research program with the Robert Wood Johnson Foundation. And the S4A mission is to study innovative ways of helping medical, social, and public health delivery systems work better together to tackle issues of health and health equity in American communities. To that end, Systems for Action funds research across the country that works to innovatively connect systems across sectors. And this Research in Progress webinar series is our way of featuring one of our research teams and to learn more about the work that they're doing and how they're bringing evidence into action. Today, we are especially excited to have a team based in Los Angeles County at UCLA that have been working on tackling disparities in health and social services among low-income pregnant women through an innovative intervention that they will tell you much more about. As some housekeeping, please put any questions you have into the Q&A box at the bottom of your screen. At the bottom of the Zoom screen, you should see a square that says Q&A. You can enter your questions anytime throughout the webinar. And we will get to them after the presentation. We'll get to as many as we have in the time allotted, and any questions left unanswered will be forwarded to the presenters after the end of the webinar. Just so everyone knows, the session will be recorded and will be available on the S4A website. And with that, I will pass it on to our presenters.
Thank you. All right, so thank you guys for having me today. And I'm really excited to be here. My name is Birgit Blebu, and I am an investigator at the Lundquist Institute at Harvard UCLA Medical Center. So I recently joined the research team about last year as an ARC-funded career, or through an ARC-funded career development award for a program called Stakeholder Partnered Implementation Research and Innovation Translation, or SPIRIT for short. Through the University of California at Los Angeles. And so I'm really excited to have been able to join this research team and engage in this work. My research is broadly interested in racial disparities in birth outcomes and multi-level health system interventions to integrate the social determinants of health in perinatal care, and specifically looking to improve experiences of care among Black birthing people. I completed my postdoctoral training at the University of California, San Francisco with the Preterm Birth Initiative, where I studied implementation science research. And so I'm bringing that lens to the work that we're going to be talking about here today. And then I've had lots of training in Southern California as far as my doctoral training at University of California, Irvine, and my undergraduate and master's training at University of Southern California. All right, so I'll start by giving you a little bit more background. We wanted to start off by just really getting you oriented to the population of the Los Angeles County Department of Health Services, which is one of the largest health safety net systems in the country. And it faces substantial burdens as it relates to adverse birth outcomes, including preterm birth and low birth weight. And these rates are really similar to developing countries relative to the rates that we see in LA County at large. So it's clear that these disparities in birth outcomes are rooted in high rates of social stressors, which we know underpin some of our greatest health disparities. The same holds true in the LA County Department of Health Services population. And we've sort of identified that it's really important to adequately address these social stressors. However, there's a really critical challenge with the broader social service environment being siloed and fragmented, which has implications for how patients are navigating these resources. And so that's really the main goal of Mama's Neighborhood, is really just to address this issue of how are we going to assess client needs and make sure that they're receiving timely, adequate, and appropriate resources in their communities. And so there are several core components included in the Mama's Neighborhood program. The first is really to make sure that we're getting a comprehensive assessments of social needs and risk factors related to medical and environmental determinants. Also incorporating strategies that are really aligning the intensity of the service provision with the risk factors that were being assessed. We also have strategies to increase the access to coordinated and collaborative care across public health, health, and social service sectors in Los Angeles counties. And so really the goal is to move beyond the clinical environment and into community settings to offer more place-based approach to perinatal care. So the Mamas Network includes a host of partner agencies that are spanning health, social, and community services in Los Angeles County. The idea here generally is that there's lots of different departments or partnerships in different domains across the very vast geography of LA County. And so we're really looking to hone in on sort of these relationships and how they're working with Department of Health Services to date, and whether or not we can sort of expand and concretize some of these partnerships to advance our missions as far as improving perinatal care. So now going on to our research questions and methodologies. We had several research questions related to this work, but broadly we were interested in first understanding the impact of Mama's Neighborhood on birth outcomes and access to social and community services. We had questions related to health equity as far as needs for high-risk groups and how those were being met, and whether or not we were addressing some of these longstanding inequities in birth outcomes. And lastly, we were interested in sort of the implementation or how effective the actual cross-sector linkages were for improving referrals into social and community services. And that's really going to be the focus of our discussion today. Again, I'm sort of overlaying this implementation research focus to get under the hood of how cross-sector partnerships are actually being implemented in Mom's Neighborhood. And so just to briefly give you an overview of our data sources, we sort of had three big chunks of research or data sources here. The first was a quantitative analysis that was bringing together birth record data, administrative data related to Mama's Neighborhood, as well as countywide data on social service utilization, which is more of a unique attribute to this study. We also have a network analysis that was really seeking to understand sort of how cross-sector partnerships were happening across LA County, the partnerships and relationships within agencies or cross agencies, as well as relationships with Mama staff within DHS and partner agencies in LA County. And then we had a qualitative exploration to understand really experiences of delivering and receiving Mama services from the perspectives of patients, providers, and key informants. So for today's discussion, I'll actually be sharing the integration results from the network analysis combined with the qualitative data that we collected specifically from providers to get that implementer's perspective. All right. So again, the goal of this integration effort was really to bring together the network data and the qualitative data, really to understand what's working and what's not working when it comes to the cross-sector collaborations in Mama's Neighborhood. And sort of broadly in the literature, despite the fact that cross-sector partnerships are widely accepted as an approach to integrating social determinants and addressing sort of social needs or unmet social needs in perinatal populations, there really isn't a whole lot of guidance on how we actually should be implementing these cross-sector partnerships. However, there are sort of emerging frameworks out there that are really geared towards understanding the foundational components that sort of facilitate cross-sector partnerships, but more importantly, might speak to the sustainability and scalability of these partnerships. So the first component is actually related to having a shared theory of change or just general process and understanding of how we're approaching addressing these upstream drivers or social determinants and what that means as far as each partner agency's position in achieving that change. And so in here, we're talking about how developing shared metrics and sort of shared planning about resources and maintaining accountability across the partners can really help ground the effort in a shared vision for how we're going to achieve change. And so the next sort of foundational component that's really important for cross-sector partnerships is a relational structure that really is putting forth leadership, shared leadership, trust, and learning among the partners. And so we're thinking about sort of network-based or horizontal coordination that among partners that's really inclusive of individual partner agencies' priorities, as well as the ways that they're delivering the care that they offer. And lastly, we have linked data and communication platforms, sort of digital platforms that may improve the way that we're using data and our communication and how we're strategizing to really coordinate care. But ultimately, these platforms and communication strategies are really intended to promote accessibility of information across the varied partners while also maintaining client confidentiality. So we sort of use this framework to kind of understand the implementation context and the extent to which Mama's Neighborhood was really reflecting sort of these core characteristics of a cross-sector partnership as far as how that might overlay with sustainability and scalability. So again, we started with our qualitative data that focused specifically on provider experiences. So that was about 18 different interviews, in-depth interviews, and included care coordinators, social workers, registered nurses, and health educators who are all a part of the Mama's sort of neighborhood care team, as well as physicians, a part of the team as well. So the interviews were sort of cross-cutting around across the geography of LA County, all conducted by phone through partnerships with the Southern California Center for Nonprofit Management. And of course, all the audio interviews were audio recorded and transcribed. So I just wanted to give you a sense of the general questions that were discussed during these interviews. We covered the intake process, collaborations among staff, the referral process generally, as well as strategies to engage clients. And then we also had the data from the network analysis, which was conducted using the partner tool from you all, Robert Wood Johnson Foundation. Originally, Mama staff sort of generated this list of 51 different organizations that they liaise with in different aspects of referrals. Of those 51, about 68% represented social service agencies. So from there, 40 members were invited to participate in the survey, and we had a response rate of about 48%. Despite this sort of lower response rate, we did see that the representation of or distribution of social service agencies versus public health and healthcare agencies was reflective of that original 51 who were identified by Mama staff. And so this network, as you can see here, is sort of, in all of the data that was collected relative to the network, is reflective of 80 unique partnerships within the network. Our data that we used for this integration process really focused specifically on implementation related survey questions that I'll allude to throughout this presentation of findings. So to integrate the data from qualitative interviews with providers as well, or Mama staff, as well as the network analysis data, we conducted a series of triangulation steps to create a convergence matrix. And so the first step in this process is really just sorting out your two different data sources and identifying sort of emerging themes that are occurring in each of the data sets. So we looked at this for the network analysis data as well as for the provider interviews. And the next step is to begin your convergence process to see how are these emerging themes sort of overlaying across the different data sets. And to do that, we developed a coding scheme where we're looking at individual themes and seeing the extent that they agree across both data sets, whether or not they're in full agreement, partial agreement, disagreement, meaning there's no sort of commonalities in the ways that a particular theme is being discussed. And then silence, which is indicative of a theme that's emerging in one data set, but not emerging at all in another data set. And so the criteria that we're using to conduct this convergence assessment is really whether or not there's shared meaning around a given implementation factor, specifically whether or not it was discussed as a barrier or something that was hindering the implementation of cross-sector partnerships. or whether or not it was a facilitator, something that was supporting implementation of cross-sector partnerships. And then we looked at the extent that sort of how this implementation factor was working was similar across these two data sets. So for instance, if we had, for instance, a finding where both Mama's neighborhood staff and partner agencies in the network data were describing sort of heavy client caseloads as a barrier for implementing cross-sector partnerships, and both of those data sets specifically described heavy caseloads as hindering their ability to engage more than one partner agency in the network, for example, then we would code this as a full agreement theme. Alternatively, if we found that Mama's neighborhood staff were reporting heavy client loads and that these heavier loads hindered their ability to address client needs sort of in their totality, whereas partner agencies, again, were sort of more leaning towards they can only engage one partner in the one partner agency in the network because of this heavy client workload, then we would code that as partial agreement. And so lastly, or the next step is really to look at the completeness assessment. So looking at the themes that are emerging and sort of overlaying in the two different data sets and seeing how those themes are speaking to the rest of the data set. Like, are you having other themes that are emerging outside of those things that are converging or not converging? And lastly, we have researcher comparison of findings, which is where us sort of getting together and reflecting on our findings and the extent to which we are agreeing with the convergence patterns that were identified. And so here's our final convergence matrix. We ended up identifying a total of 7 different implementation factors. 5 of them sort of panned out as facilitators, whereas 2 panned out as barriers. Across the different facilitators, we generally saw that there was full agreement with the exception of one, which I'll share more details about. And then we saw 2 instances in the barriers that were more indicative of silence, in that it was appearing in one way in the interviewed data, but not in the same way or at all in the partner agency data. So just to give you a little breakdown of how we began to summarize the extent to which these sort of foundational structures to cross-sector partnerships were emerging in our data set, looking at specifically the shared theory of change or shared approach process to how we're going to actually make a difference through cross-sector partnerships. We did see that one important facilitator was the fact that the care coordinators or Mama's approach really leveraged the lived experiences and knowledge of community resources that care coordinators bring in order to embody sort of a person-centered and a place-based approach to integrating these social determinants of health. So this isn't just about sort of identifying a need and attaching a referral to that, but it's really about getting to know a whole person and engaging this person in addressing their barriers to accessing any type of resource and ensuring that that resource is something that's palatable and appropriate for them in their life circumstances. And so a lot of the times this is really about the relational skills that the care coordinators have with being able to build relationships with clients or birthing people and their knowledge of community resources and sort of how that aligns with that patient's or person's experience. Along those lines, though, because of the fact that the referral process is so centralized on the care coordinator's expertise and relationships with the clients, that does mean that the referral documentation process is very centralized among Mama staff and specifically care coordinators, instead of being sort of shared across the different partner agencies. And so what that means is that there are challenges there for how we're documenting sort of shared metrics as far as are we progressing towards the outcomes that we expect to see as far as referrals and metrics related to how well we're actually completing our referrals. This isn't something that is always communicated with partner agencies, although there are partner agencies involved in the network that do have very collaborative communication and sort of shared visioning of how they're supporting clients during pregnancy. And so for these 2 factors, we did see a lot of convergence and agreement across the 2 different data sets where partner agencies were in agreement that care coordinators and this person-centered approach was really valuable for improving their capacity to actually provide holistic and culturally appropriate or affirming resources during pregnancy. This next part about relational structures I found really interesting. We did see 2 facilitators within the network, which is the fact that it is a network and that there are sort of bi-directional exchanges occurring in terms of referrals, and it's really, really collaborative. We saw some examples of partner agencies that spent a lot of time and effort with engaging care coordinators in this process, as well as sort of opportunities to share their referral processes with case coordinator or care coordinators, where care coordinators could learn specifically what these are the forms. This is a process of how you're going to achieve a quick and timely referral within our agency. There's also a lot of networking opportunities for care coordinators to interact with partner agencies, identify new partner agencies that might be a good fit for their network, or how they're sort of ascertaining which referral services to engage for a specific client. So here we're seeing that there's a lot of transparency that comes about when you have these networks and partnerships established, because you're increasing sort of access to really a lot of information that kind of ordinarily isn't there when these services are so siloed and fragmented. And so the next set of factors are really about sort of this linked data and communication platform. And this particular foundational structure does sort of emphasize the need for digital platforms. However, what's interesting about Mama's Neighborhood is the fact that it is so contingent upon sort of human capital that care coordinators bring and their relational expertise, that it's almost functioningly, in some instances, it functions very similar to a very high value sort of digital platform, which may not be accessible to lower resource settings and community. And so we saw that there was a lot of variation, and that was on the partner agency side on how they are documenting their referral outcomes, or whether or not they're documenting them at all, where you'll see things that are more informal, related to client check-ins, all the way to sort of robust data platforms that are shared with care coordinators at Mama's Neighborhood. So there's a lot of variation in between. But what that means is it presents challenges to developing shared metrics and our understanding of how we're communicating and sharing resources in that way. And so we also, again, recognizing that the relationship between care coordinators and clients is really important. I think there was a little bit of a lack of agreement here between the Mama staff and partner agencies in the network analysis, in that while these partner agencies recognize that these relationships are really important in the sense that they're going to help communicate with clients who may be difficult to connect with, because of the fact that care coordinators are really connecting with clients fairly regularly, if not monthly, on a or even weekly in some instances, to really engage these clients and keep these clients engaged. And so that's actually a really important resource for partner agencies to tap into. But there were some instances where care coordinators were kind of reflecting on the fact that they wish partner agencies would sort of reach out and be a little bit more proactive with engaging them and sort of getting more information about the client's experiences, and sort of, again, tapping into that whole person approach to supporting these people. And of course, having a designated point of contact was something that really streamlined communication in the referral process. So a lot of Mama staff reflected on the fact that having that person that you know, that once you send this referral to them, they're going to be able to communicate to you, yes, I received this referral, here's the client information on the referral outcome. Having that line of communication and knowing exactly who to go to is extremely important. And so that, again, that relationship component to it is something that is unique to what the broader literature is saying about how we can begin to improve communication on these sort of digital platforms. And so just to give you a little bit more of a deep dive into some of these findings that we had. So here's an example from this sort of network approach facilitator to how partners are collaborating. Again, we have our relational structure here, which is really about making sure that we have sort of horizontal coordination and sort of inclusive ways to engage people in an inclusive way that honors their priorities, as well as the ways that they are engaging their clients in their own programs. And so we have from one of the provider interviews, essentially saying that there are definitely a lot of referrals coming in from all different places, and that outreach and connecting with these different partner agencies is really critical to maintaining the fact that all of these referrals are coming in, and it's not just mama staff who are reaching out in a unilateral way to these partner agencies. And then we have a network analysis respondent who was reflecting on the fact that Mama's Neighborhood was also improving or being a part of the network of partner agencies is improving their capacity to provide resources that they never maybe didn't traditionally have access to, given that they were so siloed from other agencies. And so here we have some sort of data related to the network analysis that's reflecting again how partner agencies really did value and feel like the partnerships with other community-based organizations was successful. The referral system and process was successful, and referral follow-up was successful parts of Mama's Neighborhood. So another facilitator, again, related to this client coordinator and relationship as sort of a resource. I think here this highlights sort of this lack of full agreement between some of the network analysis findings and the information we received from providers in the interviews. So again, most of the time, partnering agencies are not reaching out to us, but it really surprises me because we do spend a lot of time with patients or clients. They start their prenatal appointments once a month, and then at some point we're seeing patients almost every week. So this is a huge disconnect that these agencies are not reaching out to mamas for information or just for extra support. And this person reflecting on how they actually end up calling and again, reaching out to these partner agencies instead of that sort of bi-directional opportunity. So it could be that this phenomenon is unique to different sites. That is one thing that we didn't have the capacity to do with this particular data set, but it would be interesting to see if cross-sector partnerships sort of look different based on different corners of LA County or different service environments. So that's an interesting thing that I hope to be able to look into as well. And then Mama's Neighborhood has been successful in referring patients. And so again, I think this kind of shows that these partner agencies are aware of the fact that it is helpful to have care coordinators with these really strong relationships with clients, but it just may mean that they need to sort of activate that a little bit more on their end. And so here's one of the barriers that appeared on the network analysis side, but kind of didn't really appear on the interview side. So we have a quote here saying, every referral that comes in gets entered into our database and providers like Mama's Neighborhood get recorded. Our database allows us to run reports by provider, which would give us the total amount of referrals received by Mama's Neighborhood. Each service is recorded into the database, whether it's from a form or telephone calls. Services received are documented either directly into the database or via the forms that others in their organization are completing. So this is an example of a much more refined and robust sort of referral documentation and tracking process that was unique as far as not that many other agencies were using something as complex and able to generate the type of data that would clearly yield some really fruitful and meaningful metrics related to referral outcomes. And we also saw that partner agencies themselves weren't really describing processes where they're sharing information with other agencies or even Mama's Neighborhood per se. We did have one respondent that was leveraging the MOU process that Mama's has, which allows for different levels of PHI to be shared across different agencies. But generally, sharing information or information exchange and data sharing were not the more popular activities that was happening in the partnership network. So these are areas and opportunities to improve, or at least to understand sort of what exactly are the barriers to information exchange and data sharing for these specific agencies, and whether deciding whether or not there are strategies to help improve that, while also maintaining sort of the natural ways that these agencies like to work, especially if they're more embedded in relational experiences and skill sets that are also important to honor. All right. So in summary, we did identify some really important barriers and facilitators that shed light on the implementation process as it relates to cross-sector collaboration within Mama's Neighborhood. There are definitely challenges that remain as far as uniformity in terms of tracking and referral processes. However, we do also recognize the value and the importance of care coordinators and their relational skills and how central they are to the implementation of this partnership. So thinking about additional strategies that can sort of uplift this facilitator or strength that is in a part of Mama's Neighborhood, and thinking about how we can build around a sustainability structure that would make it more efficient for care coordinators to support in communicating referral outcomes or participating in different types of data platforms. So that is very aspirational, I'm sure, but I think it's definitely a ripe area for discussion as well. So looking forward to any comments about that from you all if you have expertise in this area. All right. So again, I think right now we're working on a manuscript for Frontiers in Public Health related to the work presented here. There's also a lot of rich information related to patient experiences, which is of critical importance to me, and I know the rest of the research team. So thinking about how we're gonna uplift and center patient experiences in this as well is going to be really important for these findings. And of course, the quantitative analysis, which is so critical for our understanding of program impact and the value and sort of generalizability that we bring from this work. And so we have underway so the propensity score matching to create our comparison group, and then that will lead into analyses of birth outcomes, hopefully stratified by important structural determinants such as race or ethnicity as sort of crude proxies for structural racism. I think is of importance to me. And yeah, I think I'd like to say thank you to all of the team members who come before me, some of whom I haven't met yet in person or just in general, but special thanks to Lisa Greenwell and Patrick Liu, who have been in the trenches with me for this work so far. So I'm really grateful for the opportunity and looking forward to questions and discussion.
Thank you so much, Bridget. That was awesome. We definitely have a few questions in the chat that I can start to read. Our first one is relational coordination is a theory and measurement system that relates to this work. Wondering if you have examined / incorporated it would be helpful in your cross-system analyses, or would it be helpful?
Yeah, I'm sure it would be. And I don't know a whole lot about that, but I definitely think it is valuable. And so looking forward to learning more about that for sure and incorporating it as needed.
Mm-hmm. The next question is the network tool used from an RWJ open source, and could we have the link?
I don't know, is that a me question or a you question?
That is I think that's a you question. Or
I know that it's not open source to my question. It's paid, right? I think we paid for that.
Oh, somebody answered, partner is a tool
RWJF.
created by Visible Network Labs that has been funded by RWJF, and the link is posted there. All right. Do you find that in cross-sector collaborations, having a managing / facilitative entity like the Mama's Neighborhood Network is necessary? And did the partners in this collaboration utilize a specific collaboration framework?
Yeah, that's a really good question that didn't really emerge. So I know that I can say no, I don't think that there was a specific collaboration framework in mind, but there was a specific approach. And that was to embed the process in community. And so from that angle, I think it is an interesting question whether or not Mama's Neighborhood Network itself was necessary. I think the network didn't precede the relationships per se. So the relationships already existed for the most part as far as who was being accessed or engaged as far as the care coordinators in the community? So yeah, that is an excellent question. And I think one that it would be helpful to think through, how would we really articulate the extent to which these relationships would have existed, or how sustainable they are without the Mama's Neighborhood Network. I do know that there are certain activities like sort of the informational meetings and being able to get firsthand information from referral or partner agencies is really critical to how care coordinators do their work. And so something like that maybe is definitely facilitated by the Mama's Neighborhood Network. But yeah, good question as far as the relationships themselves.
Next question, would someone be able to touch on how this research methodology was developed? It's so fascinating and want to learn more about the process for making it happen.
Yeah, I think that preceded me. I agree. It's very fascinating and robust. I don't know if Will wants to chime in to answer that question.
Yeah, I don't know if the question is referring specifically to the methodology that you described in your presentation today, or if it's referring to the broader methodology of the whole study. They may be specifically talking about your methodology for that you kind of took the convergence methodology that you used for the paper, but I'm not. So
perfect. Well, I'll answer with that. I'll start with that one,
okay.
and we'll see if that answers the question for this person. Yeah, I think triangulation exists. And sort of the convergence approach that I took was really geared toward making sure that all of the implementation barriers and facilitators were first and foremost informed by the stakeholders who were involved in the implementation process. I think one of the interesting dynamics in implementation science generally is that there are a lot of frameworks and sort of top-down ways that you can kind of contextualize implementation processes, but sometimes it's better to just have that grounded theory approach of just understanding what people are doing, how they're doing it, and then building out from there and seeing how what implementation looks like from there. So I think now it would be interesting to look at these barriers and facilitators relative to what other implementation frameworks sort of articulate as how barriers and facilitators might shape implementation efforts, and seeing if there are overlaps in those frameworks. So I think one of the new spaces in implementation science is really how are we informing equity, and how is implementation science positioned to address issues of inequity, specifically when it relates to structural determinants. And so I think it would be interesting to look at these findings and seeing which are rooted in sort of an equity informed approach based on how these partner agencies and Mama's staff are engaging with the strategies and approaches that they're using, and who these people are, sort of as lived experience in community and expertise, and sort of what is already in place and assets that are endemic into some of these communities, I think is really interesting and important that some implementation frameworks may not cover. Hopefully that makes sense.
Awesome.
All of the above. Yeah. Okay.
That was an excellent answer. Yeah, Ethan said all of the above to which methodology. Next question, what shared case management / referral platform is being used? And what does the data from that platform tell you about the percent of clients receiving requested services, the number of organizations actively receiving requests, and the services that are waitlisted / unavailable?
That's a really good question, and something that I'm not 100% sure that we have. It would be coming from a lot of different data sources in order to really answer that question with respect to the entire partnership or the entire network. And I think if we do crack that code, it would be a monumental contribution to this space. So let's see, what platform? I do know that some people are using, I think it's HDMIS. I'm blanking on what that acronym stands for, the number of organizations actively receiving requests. Yeah, all of that information is really hard to track because the care coordinators don't necessarily track to that level of granularity. But there are decision points that are happening there, right? In terms of how they're navigating these agencies may be able to uniquely impact change or outcomes for a specific type of client. Yes, wait lists and unavailable is also information that I feel like care coordinators could definitely tell you off the top of their head, but it's not necessarily something that's tracked specifically on a given platform. Missed the beginning. Oh.
Our next question I can answer. For this person that missed the beginning of the presentation, the session is being recorded, and the webinar will be posted on the S4A website under research. You can see research in progress webinar series, and the link will be there. So next question for you, Bridget. Who are the Mama Network coordinators? Are they employed by LA County, contracted by the county via community groups, etc.?
So I think the care coordinators, yes, a combination, but the network partners are partner agencies and social services. So just like community-based entities, and some of them are social service agencies that are a part of like the LA County Social Services departments. And then there's public health, Department of Public Health agencies like Nurse Family Partnership, which public health nurses that are geographically located kind of, yeah, so in that case, there are some that are employed through LA County and others that are true community entities. So.
Did the social service utilization improve the network?
Yeah, that's a good question. And it's something that there's preliminary data that suggests that happened. However, we would need to do the difference in difference analysis in order to answer that question, which is forthcoming.
Awesome.
I love Black Infant Health.
Looks like our last question. I work in a program called Black Infant Health in Washington State, and this data and research is excellent for our program structure. However, I'm struggling on how I should suggest this to prove how being real, authentic, and relatable is very essential and a key opponent to building trust.
You should just say that being real, authentic, and relatable is very essential. I think that's a good question, and I'm very familiar with Black Infant Health and sort of their implementation approach, and it is highly authentic to what empowerment looks like for a given group of people, and it addresses very specific barriers that exist in sort of the quality of care and experiences of care and how people are receiving support, and the importance of the construct of racial concordance and what that brings as far as, yeah, authentic engagement in people and trust, right? So I think part of your question is figuring out what is the sort of social construct or construct in general that deals with sort of real, authentic, and relatable structures that are going to build trust. And so racial concordance is definitely a piece of the literature that I think speaks to that very well.
Awesome. George, in the network graphics, some dots or agencies are not connected to the network. How are these groups part of the so-called system?
Yeah, so those are most likely instances of individual agencies that the MAMA staff were in relationship with, but they were not, that agency itself was not necessarily engaging the actual network or sort of the other dots in the network, so other agencies within the network. So that just means that there are opportunities to improve connections between partner agencies, and I'm sure there's a whole richness that our data set currently doesn't necessarily tap into, what areas of improvement for those particular groups of agencies that are sort of on the outskirts of the network. How could we improve their engagements? Do we need to improve their engagement? Do they function better sort of more on the periphery? Because I think one of the underlying assumptions that you sometimes have to challenge with network analysis is whether or not there needs to be a high level of connectivity or density of relationships in order for there to be high functioning or the level of impact that you would expect to see. So hopefully that answers.
How do you use experience narrative to showcase the data?
I'm not sure what experience narrative is. Lived experience
/ expertise.
How do you use to showcase the data? So in this case, I guess my lived experiences in terms of, I guess, patient outcomes or care coordinators, or the experiences that mama staff have with delivering or implementing Mama's Neighborhood relative to the data, I guess more quantitative data in some instances that the network analysis showed, for me was really about when I had the opportunity to see like if there's a directionality as far as, okay, partner agencies are sort of agreeing percentage wise that referral or partnerships amongst CBOs was one of the more successful aspects of Mama's Neighborhood. Then I might go to see, well, how is that unfolding from the perspective of the care coordinators or other members of Mama staff, and then looking to other data points to seeing whether or not they corroborate that sort of, oh yeah, CBOs and partnerships amongst CBOs are important for this work.
Also, could you speak along the lines of talking to the mothers about their experience?
Yeah, that's a good one. So I know that data set, I haven't dived into that data set personally myself, but I have reviewed some of the overall findings from evaluation reports completed. And I know that there was sort of moms who identified as Latinx and moms who identified as Black or African American. And these individuals were, there's a desire to see if they're experiencing Mama's Neighborhood the same, or if there are sort of opportunities to improve their experiences, and how we can begin to understand whether or not, race and ethnicity is contributing to differences in how they're engaging with Mama's Neighborhood. I do know that the fact that care coordinators are also people who come from the communities that mothers in Mama's Neighborhood come from is a really huge asset to engaging patients, and sort of, I know that that's central to their experiences as well. So hopefully that sheds a little bit of light.
Awesome. I have a question. We'll wait
Yeah.
for more in the chat box. So you mentioned that the response rate for the social network analysis survey was kind of low. Do you have plans to repeat that survey and or maybe look at the data longitudinally?
Yeah, that's a really good question. I think it would be interesting to see how the network changes over time. And so, yeah, I think it would be really interesting to think about that piece, or just thinking about different methodologies to get at specific implementation contexts, because I know that survey data can only answer so much. And I think we're to the point now where we have a reasonable understanding of how the network is functioning, but now we're really trying to look at different implementation contexts so we can identify levers and sort of how can we improve experiences of a given partner in the network, and do we need to add more network partners? Yes. Does that answer your question?
Yeah, absolutely. And as a follow-up, somebody asked, was a survey completion appreciation gift offered? And I guess I might add to that, I guess for next surveys, do you have plans to improve?
Right, the response rate.
Response rate, yeah. And knowing that the past few years have been difficult.
Yeah, that's a really good question. I know that there was a lot happening at the time that this survey was implemented. I think it was at the height of the pandemic. And so I'm not sure if that contributed to the variation or the lower response rate than maybe expected. So yeah, it's definitely something to revisit. I'm pretty sure that survey respondents were remunerated. But yeah, I think that's an excellent point to consider, how we could make it more incentivized.
I have one or two more questions, or we can move to a wrap up depending on how you feel.
Yeah, how about another question?
Sure. So I was wondering, as someone who also works in social network analysis, did you see any differences between facilitator and variant analysis between some of the partners that maybe collaborated more versus those that collaborated less?
Yeah, that's a really good question. I know that's one instance where we had a lot of variations in the referral documentation process, process, those who had more robust documentation platforms tended to be the ones that the agencies that were in much tighter collaboration and more frequent collaboration with Mama's neighborhood staff. So I think, yeah, there's something to be said about those types of differences as well. And it'd be interesting to explore that with like slicing the data in that way. Yeah.
Mhm. All right, we got a couple more questions. On a scale from 1 being impossible and 5 being can do today, where do you rate this study's ease to replicate?
Oh boy, yeah, there's a lot of unique data accessibility things. I don't know, Will, if you wanted to. It's been a challenge, I'm not gonna lie, that like it's bringing together all these different data sources and making meaning out of it, and also representing the hard work that everyone continues to do for this effort is what makes it not just a heavy lift, but something of super importance. So I think possibly a 3, maybe a 2.
I think the obviously, starting this right when COVID hit, made it more challenging. I might say it was I might be more optimistic, in a different time and place. So I'm optimistic that it could be replicated as long as you're in a place where you have relatively, especially for the quantitative portion, where you have relatively easy access to like your state's vital records, so you can get birth data. And then data linkage, as long as you can link those data to administrative data from a program, which is what we have, and you have the ability to use some sophisticated methods to create good comparison groups. I mean, it gets, at the beginning it sounded, given how long it's been taking us to do this, I guess it seemed a little easier to us when we started than looking back. But at the same time, I do think there was no magic to this. I mean, I think that we were going to do focus groups, but we did phone interviews because of COVID. Engaging network lab solutions was they had a great tool in the partner tool that we could use. So maybe I'd say even a 4. I guess.
Along that same vein, someone asked, can you speak to which important components might be more replicable?
Yeah, I think the network analysis seems like a really interesting and natural place to start if you have sort of a referral process and people who are engaged in that process. Just simply asking like, hey, who do you refer to? And starting off with that general list of potential partner agencies. I think it's really fascinating to see whether or not you actually have a network or not. Because essentially the steps to the network analysis were first identifying that broad list of potential partners, and then asking those people, do you interact with any of the other partners on this list? And that's kind of the basis of your network right there, or if you have a network that, and then you just can kind of ask sort of contextual questions related to implementation that maybe are informed by how you think referrals are occurring in your geography or in your hospital system. So yeah, I think that the network analysis is probably a really easy place to start. If you have outcomes data, then of course it's going to be pretty easy to get at the quantitative aims as well, especially if you have data that's more aligned with quasi-experimental approaches and developing comparison groups so that you can have more robust and rigorous and generalizable data to share.
I think this will be our final question for today because we're running up on time. It fits well with the S4A mission. So how do you envision your findings as a tool to leverage policy, and in what ways?
Yeah, that's a really good question. So one of the things that I didn't spend a lot of time on because it didn't come up in this particular data set, but is funding structures and how funding alignment is supporting all of these efforts. And so I think when you can clearly articulate what's happening and how it's happening, you can begin to identify resources that are necessary to sustain these efforts. And then hopefully that leads to a very clear sort of policy ask, especially as it relates to allocation of funding. I know in California, I think there's a push to be more aligned with what community agencies are doing, especially on the health payer side. And so whether or not they have experience with engaging community agencies remains, I don't know how much experience health payers have in the state of California, but I do know that understanding sort of the priorities and how to align and create equitable partnerships with community agencies is a very critical aspect of continuing and sustaining that type of partnership. And so to that end, we have a really rich set of information that can say, like, these are the types of things that are going to be valuable when trying to engage community agencies in bridging this gap and integrating social determinants in healthcare. But also there has to be equitable resources allocated to such an effort. So.
Awesome. Well, thank you so much, Bridget. This was an excellent presentation and really thoughtful answers. If you could, yeah, so if any of you who attended would like to receive a certificate of completion, please complete the survey at the end of the session. It will be emailed to you. And we have our next upcoming webinar is on December 7th, and it will be on addressing the health and social needs of justice-involved young adults. Hope to see some of you there. Finally, our acknowledgement: Systems for Action is a national program office of the Robert Wood Johnson Foundation and a collaborative effort of the Colorado School of Public Health, administered by the University of Colorado Anschutz Medical Campus in Aurora, Colorado. Thank you all for your attendance today, and special thanks to our presenter.
Thank you.